Good morning. It is Wednesday, September 22nd. We are live inside the Dolph Simons Jr. Family Broadcast Studio. Welcome to the Morning Medical Update. Today, how the COVID care force continues to make a huge difference during this pandemic. We are more than a year in. It is volunteers have traveled the globe to help out. We see their faces right there doing so much hard work all over. One group in particular is the Chickasaw Nation, how they put the community first to cut down on COVID cases, how they are doing it, because they are doing it right. Dr. Hawkinson, of course, is dropping kids off today. It's Wednesday, so he'll join us here in just a moment for questions from reporters. So stay on the line for that if we have any, and he'll give us our COVID count. And yes, Dr. Stites is taking a much needed vacation. He's relaxing. He'll come back to us next week, so don't go anywhere because we have a couple of great guests today that I want to introduce you to right now. Because in studio with me today, so glad to have sitting here is Dr. Gary Morsch. He is the founder of COVID Care Force. And joining us virtually is Admiral Kevin Meeks, retired Deputy Director of Field Operations at the Indian Health Services, but he is currently serving as Deputy Secretary at the Chickasaw Nation's Department of Health. So I want to just welcome both of you, and so glad you're co-piloting with me today with Dr. Stites is gone, so I'm glad you're here. So we're going to jump into this conversation. And Dr. Morsch, I do want to start with you because you just got back from Eastern Europe. Right. I understand they have they've really been taking the pandemic very seriously in some of those areas. What type of precautions were you noticing while you were traveling?
Well, first of all, you have to be vaccinated. You can't even leave the country, the U.S., unless you have your vaccination card. And it was checked at as we went into the, went in through immigration and customs. Of course, they asked for documentation of our COVID status. We also had to be tested. Before we went. We had to have, within 72 hours of arriving in various countries, we would have to show a proof of test. And in fact, the group we were with, we were being tested every day. Every day we would do a COVID test so that they were monitoring us very, very carefully. We always had to wear a mask, of course. You always, without doubt.
Outside, inside, a little of both?
Well, no, you didn't have to wear it outside. Okay. But if you went into a restaurant or any kind of a building, private or public, you were required to wear a mask. And it was interesting, here in the United States, we've got quite a fashion industry going on masks.
Yeah, we do.
All these cloth masks with various logos and all that. But the thing in Europe and in Eastern Europe, you have to wear, actually, the mask that I wear here, except when we're on the show. Right before we got on the show, I took this off.
Yeah.
You have to wear these surgical masks.
So you can't get into restaurants without that type of mask on.
Exactly. And your vaccination card.
So they're strict.
Proof. They're very strict. And so, and you just couldn't wear some cute, KU Med, or COVID Care Force.
So just anything doesn't go over there.
No, it's not about fashion. And then, in other countries, we had to wear an N95 in Czechoslovakia, and then into Croatia, into the Bosnia and Herzegovina, they required even better masks. It wasn't good enough just to wear the surgical mask. We wore the N95 mask, the fitted ones, yes.
So
they take it very seriously.
Were you traveling with the COVID Care Force, or was it for pleasure? Were you just vacationing?
I was vacationing.
So is it worth it, though, to take all those precautions to get
absolutely,
out to
absolutely.
see the other side of the world?
Yes, and people would thank us wherever we were for coming, because so many of these countries, the economy is built on tourism to some extent. So they're very happy that we're coming and willing to go through all these hurdles to make the visit.
They were happy you were there, and you were happy to do things the way they do it, to do things safe. Yeah. So that was over in Europe. How have things been with your practice, and what are you seeing with patients right now with this COVID
Thank you.
surge?
So I'm an ER doctor. I started a group called Docs Who Care. And we staff in multiple states around the Midwest. Early into COVID, the small hospitals, rural hospitals, were worried if they would survive because economically their numbers were down. All the elective surgeries were being canceled, and so they were really, really worried. The ERs were not as busy. People were staying home. People would be afraid to go to the emergency room because they didn't want to catch COVID from somebody there. So it was very difficult for them. Well, it's completely flip-flopped. It's totally reversed now. Virtually all of our hospitals are busier than they ever have been, at least in the emergency rooms. Many of our hospitals are having to take patients from other states because Oklahoma hospitals are full, Idaho hospitals are full, other places. So we're seeing more patients. In fact, I was talking to one of our staff, and he was saying, we've become, this is a hospital in Kansas. He says, we've become the COVID hospital for Oklahoma. So we're seeing a lot of transfer patients coming in, and our hospitals are full, just like here throughout the country. So it's a tough situation. We're having to double cover, add extra doctors on our shifts, nurse practitioners and PAs, because we're just very busy.
Yeah, you're not exempt from what we've been hearing from
Right,
everyone working.
Right.
What are just your concerns right now? We're heading into the winter months. We get that question a lot about just what concerns you most with Delta. We're still trying to get people vaccinated, and now we're heading into another winter season.
Well, even though I'm a doctor, the heart of healthcare and our entire COVID care system revolves around nurses. If you don't have nurses, you can't do the job. And nurses in particular are getting tired, they're getting burnout. We have the same nurses that work in hospitals. If they have a few weeks off or can take it, they might want to volunteer with COVID Care Force. So, or they're travel nurses, and they spend 3 months working somewhere in a COVID hospital in Miami or Phoenix, and they're burnout and they're tired, and then they want to come and volunteer to go to the Navajo Nation or the Chickasaw Nation, where they really feel appreciated. They feel that they're really making a big difference. So I'm concerned about our nursing staff, and I'm sure you face the same thing here at KU Med. But we're just seeing more and more nurses just getting weary mentally, mental health wise. They're discouraged, and to think that they're taking care of a lot of people, as we say. The ICUs are, it's an intensive, unvaccinated care unit, is what it is. Mm-hmm. Very few of the vaccinated, there are, of course, exceptions, but most of the people that these nurses are taking care of are unvaccinated, and it's just hard on them.
Well, and I'm glad you bring up the staffing, because we hear a lot about, are there enough beds, or not enough beds? Even if there are enough beds, you got to have the staff.
Exactly.
And they get worn out, and there's only so much they can do
exactly.
in a certain amount of time. We're going to continue to talk about that, but I told you you're going to kind of help me co-host today, because you have brought along a fantastic friend. I'm going to let you introduce
I'd be happy to.
Our friend who is joining us virtually from Ada, Oklahoma.
Exactly.
Yes.
Right.
I will let you introduce, please.
So early on in the pandemic, as COVID Care Force was beginning, we reached out to various areas that were under-resourced or areas that we might have need. And one of my staff introduced me. He said, "I know Admiral Kevin Meeks. He's the Deputy Director of Operations for the entire Indian Health Service. This is manages the health care for some 564 tribes across the United States." And his name was Admiral Meeks. And so we talked by telephone, maybe video. He's very encouraging, and he knows all the tribes. Through the Indian Health Service, they have 12 units across the country, hospitals all over the country, Indian hospitals. And he opened doors and introduced us to the Navajo leadership and to the Indian Health Service leaders there of those hospitals, and then to the Chickasaw Nation. And I'm going to let him talk more, but this is how I met Admiral Meeks. He's been a wonderful friend, and he, I believe, has retired now from the Indian Health Service and is now the Deputy Director of Secretary of Health for the Chickasaw Nation in Ada, Oklahoma, a wonderful, wonderful Indian tribe that I've come to love and get to know as our volunteers have been working there now for the past year with COVID. So Admiral Meeks, thank you for joining us today.
Hi, how are you? 32 years
Thank you.
with Indian Health Services. 32 years you were retired, is that correct?
32 years with IHS, yes ma'am, retired in 2019.
So kind of set the scene for us, Admiral, if you will, when the pandemic first started to impact the Indian Nation. What was that like? Just play that out for us.
Sure. It might be good to set the stage just a little bit. I'm not sure how familiar your viewers are with Indian Health and in the Indian health system across Indian country. But I think it's important to know that the Indian health system is made up of a mix of federal programs through the Indian Health Service, tribes who have decided to exercise their right to self-determination and compact, and they run their own health program. They compact that from the federal government. And then we have a scattering of urban Indian health programs in a number of urban areas across the country, primarily west of the Mississippi. So when you say the Indian Nation or the Indian nations, the Indian tribe, there's no one size fits all. It varies based on geography. It varies based on the extent to which the tribe has decided to exercise their right to self-governance and self-determination. But I'll give you my experience. I was retired when this started coming down the road, and you could almost predict when COVID was going to impact a tribe or a reservation or a group of Indian people just by watching the geography of the spread of the disease. If it was in Portland, you could bet that the tribes in the Portland area, in Oregon, in Washington, were going to be exposed and be infected shortly after it hit the coast. Same thing on the East Coast. As it spread to the interior of the country, you could just watch it spread. For Chickasaw Nation, we identified our first patient. I was not here, of course. I was still retired at the time, on March 19th, 2020, shortly after the first patient was tested positive in the state of Oklahoma. So the entire Indian health system was watching the spread, doing what they could do, doing what we could do to prepare and get things in place so we could meet this thing and do our best to fight it.
So talk to us about the plan that leaders came up with to try and stop that spread.
Sure. So once again, it depends on the particular tribe. It depends on their capabilities, depends on whether they are operating their health program or not. But some things that were in common across the country, tribal leaders would work with their tribes to close or limit occupancy of tribal businesses in reservation states. Sometimes the reservation access was limited. There's a tribe in the Grand Canyon that pretty much closed all operations because they are so isolated, and they didn't want to. They're very small. They didn't want to put their citizens at risk any more than they had to. And they pretty much locked down that reservation there in the Grand Canyon. Other reservations did the same thing. Navajo Nation, which I was fortunate enough to be able to work with just a little bit on a special assignment, they were limiting access as well. A lot of reservations have poor access to potable water and sanitary facilities, less than desirable housing conditions, all of that contributing to the spread. And so they were working on the issues that they worked on every day with much more fervor, I guess, doing what they could to limit the spread of the disease. Here in the Chickasaw Nation, Governor Anatubby declared a public health emergency on March 17th. That was 2 days before the first positive case in the Chickasaw Nation. And that public health emergency opened up a lot of doors that allowed us to partner with a lot of folks from other tribes to the state, to the county, to different arms of the federal government. He closed or limited access to our casinos and other tribal businesses across the Chickasaw Nation. We implemented very broad telework policies to allow folks to work from home who were able to do that. Who had the capability to work from home, so they didn't have to come to work and run the risk of being exposed or exposing others. We implemented mandatory masking, implemented social distancing, just like everybody else tried to do. We had a daily employee health screening process where every employee, 16,000 employees across the Chickasaw Nation, had to complete a daily health screening. And they would fill out this questionnaire online based on their symptomology. And if they had fever, if they had certain symptoms, then they would fail that screening and they would have to get tested that day before they could go to work or go home and quarantine. Here at Chickasaw Nation, we implemented a incident command system early. I think it was April 2020 to run those emergency operations. And in fact, it is still operational today. They're working as we speak, just about 2 miles here from the hospital at an emergency operations facility. We operationalized drive-through testing, drive-through vaccination, implemented screening, testing, and vaccination priorities for patients and employees. You know, I can keep going on, or I can take questions. I don't want to monopolize the show. Chickasaw Nation has done so much. One thing I want to mention, and I'll be quiet and let you ask the next question.
No, you're fine.
With the CARES funding that came to the states and to the tribes, Chickasaw Nation immediately constructed some facilities and expanded some of our existing capabilities. We expanded our laboratory to meet the additional need. We expanded our inpatient pharmacy to assist with the higher inpatient workload. We built it's called an alternate care site. It can house up to 38 patients, and that was to take hospital overflow when the hospital would be overrun. We built that from start to finish, from design to walking in the door, in about 7 months. It's just unheard of how well things came together. And then we took over an existing vacant, I'll call it a department store. It was an old Kmart building, and we stripped that down to the metal studs and rebuilt it back into an emergency operations facility that has the capability for drive-through vaccines. And they, at full capacity, they could vaccinate 4,500 people a day in that facility. They had the cycle time down to the second. They had people coming over from other parts of the Chickasaw Nation to provide extra manpower. We have folks like Dr. Morsch and his group coming down to volunteer and to help us. We have folks from FEMA. It was just a massive, massive effort.
You know, Admiral, you mentioned something.
I'll stop there.
Well, what stuck out that I really liked you said, because we talked about the Indian Nation, you talk about all of this diversity, really. It's not all under one umbrella. There's so much diversity. But Dr. Morsch, I want you to kind of jump in on this conversation too, about, because you have talked about this before, how the Indian Nation has done things so right and come together and put community before the individual.
Right.
What is so special about these folks that they just think that way, and that we really all need to be thinking more that way? Talk to us about that.
Yeah, one of the great blessings, you know, I hate to say, of the whole COVID crisis is through COVID Care Forces, I've learned so much about our Native American cultures and got to meet so many tribal leaders. But there's a sense of commitment to the common good, to the community, and a respect for authority, for a respect for tribal leaders, healthcare leaders like Admiral Meeks. And so when they're asked to do something, they tend to, their first reaction is, well, I should do this. I should get the vaccine. I should wear the mask. If they have a lockdown, I should stay home, like they said. So I've asked this question many, many times. And even yesterday I was meeting with one of the Navajo leaders. You probably know John Nels out there in the Winslow Health Unit on their council. And their vaccination rate at the Navajos is between 70 and 75%. So they've reached herd immunity, essentially. And so, you know, it's that idea that it's not about me and my rights and what I can get by with, or what my right is, you know, but it's about how do we get through this together. And Admiral Meeks, I don't know if that's, you know, if you want to comment on that, and because I've seen that among the Chickasaws, just a real sense of coming together.
Yes, I think you explained that pretty well, Dr. Morsch. You know, here at Chickasaw Nation, leadership is the basis of everything that we're able to accomplish, and steady leadership, effective leadership. Governor Anatobi has been in office as the governor since 1987. He's been reelected 8 consecutive 4-year terms, and there's just a tremendous amount of trust and respect that our tribal citizens have in Governor Anatobi's leadership. You know, across the country, when bad things happen, people tend to set aside their differences and come together. And I think for First American tribes and First American nations, that spirit of coming together is much more commonplace and much more the normal standard way of operations as a tribe, as it is in other parts of our society today. So I'm proud of the tribes, how they've come together. They focused on one goal. They focused on the mission of what we can do individually and as a tribe to try to eradicate this disease. And I'm particularly proud of the Chickasaw Nation, being a tribal citizen myself. I think we've done a great job. And that is mirrored many times over across the country.
It seems like people kind of throw the term tribe, my tribe. We hear that a lot, just kind of in outside of the Indian Nation. It would just be so nice if we really operated the way you both are describing. It's just the word tribe and really its true essence of what it really, really means when it comes to fighting this pandemic. It just really setting the example. I just think I love hearing your stories when you share about these folks. I want to talk about the COVID Care Force in just one moment. We're going to take community questions here in just a second and talk to some reporters. Dr. Hawkinson is here in the house with us. He's got our COVID count. Good morning to you. Glad you are here.
Yeah, thank you.
Yeah.
It's good to be here. Our numbers are really holding steady. We are under 40 in that 35 to 40 range, which is great. We'd like it to be certainly less. We have 37 active infections right now with 14 in the ICU, 9 on the ventilator, and 35 in that recovery period. And would also like to point out that of those 37 total active infections, we have 9 that are fully vaccinated. One of those patients on the ventilators is fully vaccinated. So we have 8 that are not vaccinated on the ventilator. So you can see a substantial proportion of those with that critical illness that are on the ventilators are unvaccinated.
I think Cody's on the line. Cody, go ahead with your question. Are you there? Cody on? Okay, come back if you need to jump in on any reporter questions. I want to get back and talk about COVID Care Force. So tell us just what's next for them. I know they're very busy, but what, and then I want to talk about how people can get involved, but I'm going to let you have the floor on that one.
Well, thanks. We all thought COVID was coming to an end, and the summer, I remember when our president talked about July 4th, true Independence Day for all Americans, and I was in the same boat. I thought surely, and it didn't happen. Here we are again. We've talked about this many times, and so little by little, every site that COVID Care Force sent volunteers to, every hospital, virtually every hospital, every tribe that we worked with, every reservation has now re-engaged, asked us to come back, asked for more nurses, nursing assistants, doctors, PAs, and so we are back at it. We never shut everything down, but things were getting quiet and manageable. And now we're being asked for more volunteers than ever from hospitals in California, particularly one hospital that's near the Dixie wildfire. Their staff have had to deal with the fire and all of their own personal homes and all that. So we're getting nurses for them. We also, of course, we have volunteers in Mexico again, back in Mexico, and Tijuana, Rosarito, and other communities across the border there. Working in Pueblo, Colorado, we'll be back there again. We had up to 10 volunteers there at a team a year ago, and with the Chickasaws as well. I look forward to seeing Admiral Meeks down there on one of my trips, and then also with the Navajos. So we're very busy. I would guess our roster of requests right now is at 20 or 30. We also have been sending, FEMA contacted us about a month ago, and because of the gearing up for the booster vaccinations, which are going to be happening soon, all over the country, and hopefully soon boosters for everybody, and then of course for children. That's what we're all looking forward to. We're going to be very busy. So we are looking for non-medical volunteers as well as medical volunteers. So contact covidcareforce.org.
That was my next question. Okay, and we'll get more information to anybody who wants that, and we'll get that put up there. Cody, are you back on the line with us?
I am. Sorry for the technical gremlins.
That's okay.
Can you hear me?
We get those a lot
good.
around here.
Yeah, I hear you. So President Biden set to announce today that the U.S. is doubling its purchase of Pfizer vaccine to 1 billion doses to try to get other countries to the point where we are even past that. He wants to get 70% of the global population vaccinated within the next year. And with the announcement that travel to the U.S. is opening back up very soon within the next month or 2 months, I was curious, Dr. Hawkinson's thoughts, or anybody really on the panel, about the importance of getting other countries vaccinated, just more on a macro scale when it comes to fighting the virus.
Yeah, I mean, I think absolutely, without a question, it's important to get other countries vaccinated. We have heard a lot of talk of the higher income countries have, taken a lot of the vaccines. Initially, that was true. But there continues to be very, very many populations and countries that don't have access to vaccines. So I think it is vitally important for all of the world. And we know that the World Health Organization has a good program to try and distribute those vaccinations to those underserved countries and those lower income countries as well. I think overall, we do know and we do understand there's a lot of division here in this country. We understand there's a lot of division in other countries. But unfortunately, this is a world problem. This is a pandemic for the whole world. And you are only as strong as your weakest link. And so we really need to continue to focus on our own health in our country for sure, but also provide resources, those resources that we can. And right now we have a lot of resources to be able to do that with being able to provide vaccination to other countries. So I think it is important that we do that as a whole, certainly for it. But it's not only COVID vaccination either. We do know and understand that other illnesses and other infections have seemed to increase since the pandemic, either because of lack of infrastructure and public health resources in those countries, but also we know that the vaccination programs were cut short as well. So absolutely, we need to continue to provide what we can, resources, vaccination to other parts of the world, especially those underserved areas and lower income areas, but not only for COVID-19, but other medical conditions as well.
Dr. Morsch, anything to add to that?
Well, it's not just having the vaccine available, which is tremendously important, of course, but it's also people making the decision that they're going to get the vaccine. And I don't know if I heard this statistic, Dr. Hawkinson, from you or this program or where, but I think I saw or heard that the U.S. is ranked about 47th in the world in its vaccination rate, in spite of us being the richest country and having vaccines so available and so easy to get, yet our vaccination rate is still low compared to most of the other developed countries in the world.
Surprised to see it so low,
Yeah.
are you? Well, especially with the travels you've been doing.
Right. Well, and again, back to the Indian tribes, their vaccination, once they got a hold of this and got the vaccine, I mean, they started vaccinating really quickly. The Navajo Nation reached 70% or so months ago, a couple months ago. So they kind of led the nation in getting their members, tribal members, vaccinated. And again, it's back to this idea that we respect our leaders. They've asked us to do this, and so we're going to do it, even though we don't understand. And there's a lot of myths about the vaccine here in our own country. I mean, it just never ceases to amaze me, the very, very intelligent people, friends of mine, and passionate, and they'll just have these strange ideas and questions and why they're not going to get vaccinated. Well, among our first Americans, Native Americans, they have a whole ideas of medicine and health that's even beyond what we have. I could expect a Native American to say, well, I'm not going to get a vaccine from this Pfizer company or whoever. Look how they've treated us over the centuries. Why am I going to trust them? They're going to come in here. Maybe it's a ploy or some kind of a complicated idea to take control of our bodies or to poison us or something. Well, you could expect that from certain cultures, certain peoples, but not the Native Americans. In my experience, they step forward. And Admiral Meeks, you talked about the groups out in Washington State. We're working with them in Grand Coulee. Washington. You've probably, I'm sure you've been out there when you worked with Indian Health Service. So this is the same attitude I get wherever I go in general. Sure, you're going to have skeptics, but the idea that there's some behind the scenes scheme to take over people's bodies or whatever, or that there's danger in these vaccines. I think most people believe what their leaders say, which is it's far more important to get the vaccine. Yes, we can't say it's perfect, but it's so much better than anything we've ever had. And then I'd like to go back at some point and talk about the flu season that's coming up, because that's going to be a worry as well. And there's always been people that didn't want to get flu shots, but I would like to have Dr. Hawkinson perhaps talk about the flu season's coming.
Yeah.
We're worried about it.
Yep. Yeah, I mean, certainly we know that last year for influenza season was really low or almost no activity in the United States. But those things have changed now because our non-pharmaceutical interventions have changed, the masking, the distancing. So I think we are always ready and always poised and on the lookout for an increase in cases or a surge in cases of any illness, but in particular this year it will be influenza along with COVID-19, and we don't really know what that would look like on a grand scale. Certainly when the pandemic first hit, it was at the end of influenza season, so there were a handful of people that had both infections. But I think we are always concerned about that if there is an increase in cases or a surge in influenza season this year compared to last year, what that will look like when people have co-infection with COVID-19 and influenza as well.
And
so it is vitally important to get that influenza vaccine if you're to offer now. Now we are, in the late September, so you can certainly go get that. We never want to miss an opportunity to vaccinate, and you are able to get both vaccines at the same visit.
Are you saying you knew what I was already going to ask you? That's kind of what that
Yeah.
sounded like. Because
Yeah.
I was going to ask you that because people are asking, can I get it at the same time? Do I have to wait? Is it okay? Just get it. Is that right?
Yep. The guidance is never miss an opportunity to vaccinate. We know there's concern about people getting COVID vaccine and influenza vaccine around the same time. There's no contraindications to that. You can get both vaccines at the same visit.
All right, we are going to get to some community questions. We've got a couple for you, Admiral, as well, but I'm going to start off with one from Anil. Good morning to you, by the way. Did we have a dip before the winter surge last year? Dip in cases, Dr. Hawkinson, any thoughts on that? Did we?
Yeah,
have
I don't know
dip?
exactly when it was, but remember the cases were not too high. The hospitalizations weren't too high, and then December, January hit, and that's when we really saw our peak as far as hospitalizations and cases go. So there was, again, there's good graphs. New York Times, Washington Post. In our local area, certainly Casey Star has good graphs as well. Just kind of go take a look at those. We do understand now that cases in our current situation probably are not the best bellwether, but we are really focused on the hospitalizations just because we understand that people may not go get tested. They may test at home. They may just stay at home if they know they've been exposed and have symptoms. So the cases, although can be a good measuring stick, we do have to take that currently that data with a little bit of grain of salt and really continue to focus on seeing what the hospital numbers are around our community.
And kind of on that topic, Patricia says, do you suspect that air travel combined with holiday travel will be the cause of the next pandemic spike? What are your thoughts on that?
I'll answer and throw it to our guest here. It's really hard to speculate. I think what we have found is that when people do the proper things during air travel, that is wearing the mask when they get into the airports. We know there are still mask mandates in those airports. Wearing the mask on the plane, those things you can keep yourself safe. Another level of protection is wearing eye protection as well while on the plane and in those small areas. But really the air travel itself really seems to have been fairly safe considering all the people that are traveling and really all of the contact tracing or the spreader events that have been documented on planes, which is very few compared to the number of people who are actually traveling. So I think we know how to protect ourselves. We can continue those non-pharmaceutical interventions. Now, if you're talking about once you get to the area and you're meeting with family, yeah, I think once you've landed and are in your destination, that can certainly aid in spreading the disease as well, especially if you're having large gatherings.
Admiral Meeks, Mike has a question. Any use of early on treatments with the populations that you're working with in order to help them stay away from these surges and overpopulated hospitals? Any early treatments?
One of the early treatments that we've instituted here are the monoclonal antibodies and the infusions that are done here. We started off with we were able to locate one bed to set up our infusion clinic, if you will, and now I think we're up to 8. I think we're doing 16 infusions a day. We're not quite meeting the demand, but as soon as someone exhibits symptoms when they request that or when the doctor thinks that will be in order, we immediately get that patient scheduled for an infusion when our workload will allow us to do that. So that's one of the treatments that we're using here. There are other pharmaceutical interventions that are done both inpatient and outpatient. I'm probably not the best one to describe those, however, but yeah, we're looking for every weapon in the toolbox of what we can use to attack this disease.
Admiral, as we wait for the vaccine to be available for all children and hopefully soon at least 5 to 11-year-olds, what will the vaccination process be like? Do you think it'll be similar when you've been getting the adults vaccinated? Do you think it'll be as smooth as it's been when it comes to getting the children vaccinated?
I do think we have a very refined process here at Chickasaw Nation, and I do think it will just be a continuation of that. We've had flu vaccine clinics for a long time, both walk-in and drive-through, and we are prepared to adapt that to our system with COVID involved now. So we started our flu clinic yesterday for employees. We'll be opening it up to the communities in the very near future. One thing I would like to say, with American Indian and Alaska Native programs, by law, we generally only serve people of American Indian, Alaska Native descent, with a very few exceptions. One of those exceptions is a public health emergency. So Chickasaw Nation and most other tribes in Oklahoma, several across the country, are making their testing and vaccination services available to the general public. So anybody that comes in that wants a shot, we're going to give them a shot. Anybody that wants tested, we're going to test them. And the mindset is we're all integrated. We all live in the same areas, and it doesn't matter what ethnic background one comes from. The disease is non-discriminatory, and we want to get everybody vaccinated that we can. As the saying that's going around here for the past year, a rising tide lifts all boats. So whatever we can do to help everyone involved with this situation, we're going to do it.
So opening up the community, that's a great message. Mm-hmm. Dr. Morsch, we've got some travel questions today, and since you've been kind of our world traveler and mentioned that you had just come back from Europe, I do have a question from Peg. Curious, because I know a lot of people are thinking about traveling right now with the holidays, but if you had tested positive, I know they were testing you daily, had you had tested positive or became ill on the trip, what would you have done? Right.
So, the rules are set up and the policies are established, so you kind of know. But we would be quarantined. They would continue to test us at various intervals, but we would have been quarantined there at wherever the geographic area we had. And then once we were through quarantine, we would be allowed to return back home. So that is a worry. That's why it's so important to be vaccinated before you go, and of course to follow the guidelines and all that. We saw among all the various people I was traveling with, the various groups I interacted with, there were no positive cases that we came in contact with or heard of. So I think traveling internationally is relatively safe. Of course, if you're immunocompromised or you have a condition, or and I'm assuming you're going to be vaccinated when I'm talking about travel, or if you've got young children at home that you're cocooning and you're trying to protect, this would not be the ideal time to be traveling internationally. So there are some caveats to consider.
Yeah, not a free-for-all. And
Exactly.
certainly just because you're vaccinated doesn't keep you
Give
from...
you a pass.
Do not get a pass, and you still have to do all the things that we have been doing. So I'm glad you mentioned that. We're going to get to final thoughts here in just a moment. Lisa has a question. Dr. Hawkinson, I'll let you start. My dad is ready for shot number 2, but has a plane trip planned. Does your immunity from shot 1 plummet after the second shot before you can build back full force immunity? Is that a thing?
No, I mean, I think, from that first shot, you're really just starting to build that robust immune response. There's really nothing that is going to decrease that for any measurable amount. We still consider, in a lot of the studies, they are looking at people who've had their first dose, people who are, say, less than 10 days after their first dose, or people who are less than 7 or 14 days after their second dose as well. So really that time period between the first and second dose, you're not going to see anything too measurable or clinically significant.
Okay, so Admiral, I have a question for you, though. I was going to ask you about when someone doesn't want to get vaccinated within the tribes, how, we know we've seen this butting of heads here, all over the world. What is it like, and how are you managing through just the social impact of vaccinated versus unvaccinated? Just your thoughts on that. Hopefully people are a little gentler there.
Yeah, it's how do I say this? It's more social pressure from gentle pressure from those that have been vaccinated, encouraging those unvaccinated folks to look at the benefits of the vaccine. Dr. Morsch described some of those concerns that are out there. They are here too, and we deal with those questions every day. We try to limit the exposure between vaccinated and unvaccinated. Even when we were through with that major surge last summer and we started relaxing the standards here, still there were no face-to-face meetings involving unvaccinated people, even within the tribal operations. I don't think Native Americans are any different than anybody else. We're a social people. We like our family gatherings. We have our weddings. We have our events. We have our reunions. That's been a major spreader here in Oklahoma, as I'm sure it has been everywhere else. We have different media events where we try to get the message out about the vaccine. We try to convince folks. What I've found is that if someone, for whatever reason, is against the vaccine, all the scientific arguments in the world are usually not going to convince them, and it turns into a personal credibility and a personal plea for them to consider taking the vaccine. Unfortunately, that's almost always a one-on-one situation, and it is a slow process to try to spread that message with that personal approach of trying to convince people to take the vaccine for the right reasons, to protect themselves, to protect their family, to protect their tribe and community. So it's case by case.
Yeah.
And we do the best that we can.
Dr. Morsch, do you find, though, that just educating through kindness seems to work better? Because you, as a physician as well, I'm sure you've had to help people get on the other side, help educate. And, we don't talk about vaccine shaming, but vaccine educating. And that's why we continue to do this show every day, as to continue to answer the questions. What are your thoughts on that?
Well, the using social media to beat people up, or as Admiral Meeks says, throwing every scientific argument sometimes is not going to change certain people's minds. But I think gentleness and kindness and empathy, trying to understand, and I think we're making progress. We are making progress, little by little. And when the vaccine is expanded, the boosters, and then to children, the more time that goes by, I think people in time start saying, well, I heard about my neighbor. I had an email from a dear friend and lost both parents and other people, and none of these folks were vaccinated. And my first thought was to say, see, but that doesn't help. I can tell you the people in their circle of influence will be getting vaccinated. So it's just a matter of time. That's why in the meantime, wearing the mask and following guidelines is important. And social distancing, and we still have to do that until we get everyone vaccinated.
Yeah, the "I told you so" tactic doesn't work, right?
No.
Thank you for that. Okay, so Admiral Meeks, thank you so much for being with us today. I want to get to your final thoughts, but I have a couple of comments from some of our viewers I just wanted to share. But Sarah, just in talking about the Indian Nation, talks about how this respect is embedded into the culture to take care of each other, especially their elders. And then Cindy says, "Hello, Admiral Meeks. Thank you for continuing to serve where you are most needed." So people showing you the love this morning.
I appreciate that. Cindy was just retired recently as a commissioned officer after 30 years, and we served together on a few deployments and emergencies. She's been a good friend over the years. So, hi, Cindy.
And just your final thoughts, Admiral. What do you want us to know as we head out today?
I think what I want to know, what I want folks to realize, we are all in this together, and maybe we won't ever get to be 100% vaccinated. But if we can get that 75 or 80%, create that herd immunity, I want people to know that there is no great conspiracy. There is no manipulation with this vaccine, that this vaccine is science greatest effort to prevent obtaining the virus. Or if you do get the virus after vaccination, you have a much less serious case. And chances of you going in the hospital with that virus are much less. I agree with what one of the doctors said earlier. Here at Chickasaw Nation, 95% of our COVID admissions are unvaccinated people. To me, that's evidence enough. But just do it because it's the right thing. There is no conspiracy. We want to make people better. We want to keep people healthy for generations to come.
Well said, sir. Thank you so much for being with us today. Much respect for all that you are doing and all the hard work you're doing down there. So you're welcome back on our show anytime. You, Dr. Morsch, always welcome back as well.
Thank you
for being here with me, sitting here keeping me company today.
Thank you.
So just your final thoughts. What do you want us to know?
Well, again, we're all in this together. I think that was one of the great messages from Admiral Meeks, and I appreciate KU. Again, this has been a great contribution to our community and to our country, and people from all over watch this and get information from it. COVID Care Force, our little not-for-profit, we're continuing to recruit. We need particularly nurses, but whether it's doctors, PAs, nurse practitioners, medics, paramedics, CNAs, and non-medical. All these testing lines, all these vaccine lines use non-medical people as well. So we continue to send volunteers, and we're raising funds because we cover the expenses of all of our volunteers. So please go to our website. You can see it there, covidcareforce.org, and join us in this great effort. We're all in it together. That's fantastic.
So if someone wants to help, you will find a spot for them.
We will, promise.
Love that. Thank you, Dr. Morsch. We always appreciate you. And Dr. Hawkins, and I'll let you wrap us up.
Yeah, I want to especially thank our guests who are doing the footwork and groundwork, but also giving their education to me and our audience about these very important topics. And again, today we really have centered on vaccination, and we want to continue to center on vaccination and endorse that message. Why? Because vaccination still works. We know that vaccinations work against the original Wuhan isolate or strain. We know that they have continued to work against the variants that we have seen. And a lot of people have concerns about other variants that pop up, and we do anticipate that at some point other variants will occur. However, what we should state right now is that Delta has continued to run around the world and continue to be prevalent in any area that it seems to get into. So people were concerned about Beta and Lambda and Mu. Well, right now, we do know that the World Health Organization has really taken some of the other variants out of variants of concern. And what you can see here, and this is from a website called covariants.org, and it tracks the variants. And basically what you have is on this picture here, you have three different countries, United Kingdom, Germany, United States, and what you see are those lines of colors. And you have a yellow, I think you have like a maroon or a beige or I don't know, some kind of red color, orange. So basically the orange is alpha, and you can see that on the lower axis there it has time. And over there on the far right of all of those graphs, you see the green, and the green is the Delta. So you can see how the Delta prevalence has increased in those countries since mid to early June all the way through now. So currently Delta continues to be the prevalent variant. The same thing has happened in Kansas as well. So right now, this is another picture again showing from about June to about now, that you see that large green, and basically that means that all of the proportion of isolates that are sequenced are the Delta variant. So you can see how easily and quickly it expanded. And once Delta gets into a community, it does become the prevalent variant in that community. Why? Because there is some fitness advantage, whether it's replicating more, so it's expressing more out into the community, whether it's other viral characteristics. But we have good evidence that it is more fit, is able to outcompete the other viral variants. But the take-home message is that vaccination, even vaccination if you got it in January, still provides great protection for you and your loved ones against hospitalization, severe disease, and death. So continue to talk to those people that still haven't gotten vaccinated, and please encourage them to get vaccinated.
And you just explained why Delta is different. That's what we say every day. Okay, so thank you all for being with us today, as always. We're going to catch up with a group making quite the journey, cycling from Colorado all the way here to Kansas City.
All of this money that we are raising will hopefully help find a cure for cancer so people don't have to suffer any longer from this.
We are live at the finish line with the remarkable stories of those touched by cancer. All that, plus we take your COVID questions. As always, we will see you here tomorrow starting at 8 a.m. Have a great Wednesday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.